Hi, welcome once again to Senior Focus. I'm your host, Bill Adams, and Senior Focus comes to you because of the good graces of Channel 20 and Greg Roten from Armstrong Cable, so thanks to them. And thanks also to Keith Kaiser and all the folks at the Mill Creek Metro Parks. And as you probably can tell, if you've ever been to the Fellows Riverside Gardens and the Davis Center, we're outside today overlooking beautiful Lake Glacier. And today's show is a little different. What I was going to do is talk with you about how to select a nursing home and also assisted living facilities based on not just guesswork or, maybe you heard from a friend who heard from a friend that something is good, but actual survey information that's collected by the federal government. And then that's published online. And if you go through and follow me through the program today, you're going to know more than 99.9% of the public about how to select a nursing home and what's the best way to go about that. And why this is important is, if you think about it, if you were selecting, say, a car, you go to buy a car that's $20,000 or $30,000 or whatever the cost, you're probably going to do a little bit of research, I would guess, most people do. Well, think of going into a nursing home, whether it's yourself or your family or friends. It's going to be like paying for a car every year or more for a number of years. So, it could run up in the tens or even hundreds of thousands of dollars that are eventually spent if you move into a nursing home. So what I wanted to do was go through, and you'll be able to see and follow along, hopefully, the right way to find a nursing home. And one of the first things you want to do, probably the first thing, is to go on the computer. Now, if you can't personally, or you're not familiar with computers, go to your library, and a librarian can help you with this, or a family member. But I think just about everybody here can find somebody that can assist them. But if you're computer savvy, it's pretty easy, actually. What you want to do is go to Medicare.gov, and I've circled that. This is the actual page that you would see. This is printed out, Medicare.gov. And you see below where it's circled, Find Nursing Homes. So you want to click on that button. So once you click on Find Nursing Homes on Medicare.gov, you're going to come up to the page that's called Nursing Home Compare. And Nursing Home Compare will give you a box here where it says, put your location in. And in this case, I've entered Youngstown, Ohio, Youngstown, OH. And when you do that, you click on that, and then you're going to come up with nursing home results. Now there's, for Youngstown, Ohio, there are over 60 homes because it's the default setting for the computer, for the government page, is it goes out 25 miles. So this is going to take in homes in Mahoning, Trumbull, Columbiana County, all the way out into Pennsylvania, into the Newcastle and Sharon area. So what you would do is, once you have that 60-some homes that are listed, there's I have it circled, it's called Overall Rating. And there's a button there, and you would click that. Now you click and then wait a little bit, and it'll bring up the homes actually in the way you don't want to look at them, because it'll bring them up from the lowest rated home. So I would click on that twice. The second time when you click on it, it's now going to come up with the highest rated homes. And the rating will be a star rating, and you'll see that on the right-hand side of the page. So that's basically how you find out these ratings. This is the most important thing, and this is really the reason for this program. When I did this research just recently, in the last month or so, I went through and counted, and Mahoning County currently has 24 nursing homes. 2 homes in Mahoning County received a 5-star rating, and that's on the federal survey, or the federal website. It's listed as much above average, 5 stars, that's the best. 6 homes received a 4-star rating or above average. 3 homes received a 3-star or average rating. 1 home received a 2-star or below average rating. And here's the unfortunate part and the newsworthy part: 12 homes received a 1-star or much below average rating. So again, there are 24 homes in the county, fully half of them received that 1-star rating. So what we're going to do today on today's show is go through how the federal government comes up with that rating, what goes into it, and again, what you want to look for. This is part of what you want to look for when you're searching which nursing home you would sign a contract with and again, pay a lot of money to. So the next thing you're going to do, well, we're going to talk about are the criteria that the federal government uses. Again, the federal government will contract with the Ohio Department of Health in Ohio to do surveys. And they go out to, I think there were about 1,000 in Ohio, almost 1,000 homes, but all the 24 in Mahoning County. And these surveys are done on a regular basis. They're unannounced. And the criteria, that survey process is one of the things. It's the inspection and the results of that inspection that are on the, as the first criteria. The second is staffing. Those are staffing numbers, and we'll talk about how they arrive at that figure and, again, where you can find it. And the third are what are called quality measure ratings. And, again, every home in the United States is rated on a series of, there are about 12 to 15 of these ratings that are based on care issues in the home. And the home each home gets a percentage based on the information on their residents that are in the home. So again, going back to the surveys, the Department of Health will come out unannounced. They show up and they have a crew of people, and they'll usually last a little less than a week. They'll be there for a few days. They observe the care. They'll go around and they'll watch the food service. They'll check with nurses as they pass medications. And they do a whole series of things. They talk with the residents at a resident council meeting. And one of the things that they spend a lot of time on, though, is chart review, where they will take a sample of the, say there are 100 residents in the average home. They will take a small number of those, but a significant enough sample, and then they'll go through the resident charts to make sure that those are in order. Those results that come out of that inspection survey are public information, and I'm going to show you how to do this on your own, in your own home or at a computer. But if you go to a nursing home, they're required to let you see the copy of the survey, their most recent survey, and I would certainly encourage you to ask for a copy if you haven't already done that at home. But again, I think the better way is to do this research online before you go out to make your initial visit. This is one of the things I want to stress is never sign an admissions agreement with a nursing facility or an assisted living facility unless you've reviewed their survey report. Okay, and in reviewing how to find this online, we talked about the Medicare.gov site, and again, just to go back to that, we have the Find Nursing Homes box. Okay, so you're going to click on at Medicare.gov, Find Nursing Homes. Then this page will come up, and you could type in Youngstown, Ohio. And there's another box where it gives you the nursing home name. So if you say you had a home in mind, ideally you want to check out 2 or 3 different places, but you would put the nursing home name right in that box. Okay, so type in the name there, and then click on that name, and the page will now say Nursing Home Profile. Okay, that's what it's going to say. On that nursing home profile for that particular home, you want to click on a tab that's easily labeled Inspection Results. This will provide a summary of any deficiencies that were found by the Ohio Department of Health. Okay, now beyond that, this is an important note too. There's a button that says View Full Report. Again, it says View Full Report. make sure you click on that. When you click on the View Full Report button, you'll get the full details of what the state surveyors found during their detailed and expert evaluation of the home. And I would say that no single piece of information is more important when choosing a nursing home than reviewing this full inspection report. You should take a copy, you could print it out, you take a copy of the full inspection report with you when you speak to the home's admissions director or administrator or director of nursing, the persons that you talk about before you sign a contract. Any questions about issues on the report, you should ask, if you have any questions, you should ask them. Ask them specific details about what you've seen on that report. Ask how the issues have been corrected. If you don't get a good answer, the chances are the problem still exists, and also you may have problems resolving your own concerns if you move into the home later. So it's just common sense. If you talk with them about their survey and they have a well-reasoned and a specific answer, and they could say, this is what we did and it's now not a problem, you could rest easier. But if it doesn't sound right to you, well, the chances are, again, that's still an issue, and that may give you some information again in making your ultimate decision. So those full nursing reports are important. The second criteria, again, in this process is called nursing home staffing ratings. Okay, the government basically looks at the 2 weeks before the survey was conducted. They'll go back and they'll find the total number of hours worked by different types of staff. Now, these are all hands-on care staff, so they're not going to look at the office secretary. They're not going to look at housekeeping, but they're going to look at the total number of hours spent by the RNs, the LPNs, certified nurse aides, and also physical therapy staff. So what they do is they take that total number of hours and then they look at the total number of residents that were in the facility in that 2-week time period just before the survey, and they come up with an average daily amount of time spent by each of those type of staff with each resident. So you should compare those staffing numbers, which again you can get at that Medicare.gov website. You compare those staffing numbers from each home's report when you're choosing between 2 or 3 or 4 different places. Make sure they exceed the average staffing numbers for the state. And those are listed on the Medicare.gov, but I also have them here. For example, and we'll just go through, say, the state of Ohio. For the average nursing home in the state of Ohio, total licensed nursing staff hours is 1 hour and 38 minutes per day per resident. This breaks down into 44 minutes for RNs and 54 minutes for LPNs. Nurse aide hours, or time spent per resident per day, is 2 hours 19 minutes. And finally, physical therapy staff is 4 minutes. So what you could see by that is nurse aides at 2 hours and 19 minutes provide the bulk of hands-on care. So one of the things you want to do with that information is you want to ask about what kind of training they have for the nurse aide staff and what is the turnover rate among that staff, because in the end, they're going to be providing the bulk of the care. I mean, the nurses certainly will be there. They're going to be especially interested in, medication passes and more serious healthcare issues. But when it comes to, getting up in the morning, getting bathed and fed, and getting transported around or helped in walking around the facility, the nurse aides are doing that. So you want to make sure when you look at, again, the staffing numbers as the second criteria in the federal government's report, that the staffing numbers are at least average and hopefully above the state and national averages. So that's criteria number 2. And then criteria number 3 are what are called quality measures. Now, these measures look at a number of different health and care issues that will come up in nursing homes, and they're designed, the reason they publish these is to give consumers information about what the quality of care is in any given home. And what I guess has frustrated me over the years, and I should have maybe mentioned this at the very beginning. I spent 7+ years as an ombudsman, and we'll get to what that is.